We serve a population of over 500,000 patients from our community setting and have done so since the 1970s. Our patients very much prefer to have their care delivered close to home, and they benefit and appreciate the services that we provide from the Haywood Hospital, which is our hub. And it's a very special hub that has all the facilities that we need for delivering musculoskeletal care to patients, including a day case unit, inpatient ward, and so on. Well, a great milestone for us for our service was the appointment of our first community rheumatologist in the UK, and we've been able to build on the foundations of the service that she established, bringing care closer to home for patients. A key feature and real strength of our service is our multidisciplinary team, and they have a pivotal role in the leadership of our integrated services. And we've been very lucky to have funding and support from the Haywood Foundation, which was a charity set up in 1977 dedicated to providing support for patients with arthritis and related conditions. And their funding has enabled us to pilot services that we could then build the business case and establish those services for the longer term. And they've also funded the training and education of the multidisciplinary team, which has enabled them to enhance their skills and therefore the services also. One of the biggest challenges that we've found with all of these integrated services that we deliver has been changing the perception and culture, particularly of clinical colleagues. Really so that they can appreciate the service that's provided by the whole multidisciplinary team, and that they will take on the advice and the expertise from our MDT colleagues, our extended scope physiotherapists and consultant physios and nurses and so on. Although the majority of colleagues, clinical colleagues and commissioners do now appreciate our service, we do still occasionally run into difficulties. Recently we had a case where a certain investigation that was being requested, it was being refused if it had been requested by a physiotherapist rather than a medic. We do work around these issues, and we've been able to do so through our very strong working relationships that we maintain with our colleagues in the acute trust and in the community. At times we've also struggled with gaining the necessary sort of recognition and understanding of our highly specialised status within the community trust, which is fairly new and is very much focused on providing care, integrated care, health care, social care in the community, and less experienced in actually sort of providing and championing the specialist service that we deliver. We also find that having GPs with special interests within our team has enabled enhanced dialogue with our colleagues in primary care and with our commissioning GPs.